fuck? What the fuck? What the fuck? He's alive. Well, he's alive, by the way. What the fuck? What the fuck? What the fuck? What the fuck?
This patient was referred to me for endodontic treatment of tooth number 4. Same patient that I just talked to you guys about, discussed tooth number 3, came to see me in 2020. And the referral slip from the dentist said number 4, root canal treatment of tooth number 4. The dentist diagnosed tooth number 4 as being the source. Well, as I always tell you guys, I don't trust anybody to diagnose for me. So I did, of course, history taking, and did my own tests, and it was indeed tooth number 2. It wasn't tooth number 4. Patient had had a composite restoration of tooth number 2 2 months prior. Went to the same dentist, and of course, sometimes cognitive dissonance dictates that we don't see our own flaws. So the dentist who had done the composite restoration of tooth number 2 said no, tooth number 4 was the problem. So if I had listened to this patient, to this dentist, I would have done a root canal on the wrong tooth. So I did my test, and tooth number 2 was the problem. And as you can see, here's the date. And this would have been the 3-year post-op of tooth number 3, by the way, because I had done this root canal for this patient 3 years prior in 2017, and she came to see me for examination of the upper right side, and her chief complaint was pain to cold. Anyways, all right, so that would have been 3 years post-op tooth number. Again, short fill doesn't mean anything. Doesn't cause endodontic failure. And this would have been, I just showed you a 7-year post-op, the 7-year post-op of the tooth, but this would have been the 3-year post-op of tooth number 3. Again, you can see tooth was in full function even then, 4 years ago. No issues or periapical lucencies or problems. So we diagnosed tooth number 2 as being the source of her pain to cold, and not tooth number 4. And we went ahead and did a root canal on this tooth. And here is the post-op of immediately after we did the root canal for her on tooth number 2. As you can see, MB1, MB2, distal buccal and palatal. And again, you can see maybe short a little bit, but again, I proved to you, not just by this case, but hundreds of cases that I've posted, and of course, multiple research, endodontic research, showing that the extent of obturation does not cause endodontic failure. And again, here's the date. So 2020, 4 years ago. So that was immediately after we had done the root canal on this patient on this tooth. All right, 4 years ago, immediately after. And here is the 4 years post-op of the tooth. Here's the 4 years post-op of tooth number 2. Tooth has a crown on it. Tooth is in full function. As you can see, no periapical lucencies whatsoever. No issues, no problems with this tooth. And this is again another angulation of the tooth. Another angulation here of the tooth. 4 years post-op of tooth number 2. And here's the date, as you can see. Right here. 4 years post-op of tooth number 2. Tooth is in full function, has a crown on it. No symptoms, no periapical lucencies, no issues. And again, 7 years post-op of tooth number 3. And again, you can see how short I was here. Didn't cause any issues, any problems. So 4 years post-op of tooth number 2, 7 years post-op of tooth number 3. And as you can see again, here's the date. So there you go.